My name is Mariana Chilton. I'm a professor at the Dornsife School of Public Health, and I'm the director of the Center for Hunger-Free Communities. And at the Center for Hunger-Free Communities, we do research and advocacy and civic engagement all around issues of hunger and poverty. When I first came back to Philadelphia and started to do ethnographic work with low-income women who use food pantries around the city of Philadelphia, that's when the issue of violence and exposure to adversity really started to come out for me as something that was very central to the issues of hunger and poverty. I wasn't really prepared for that intellectually, but underneath I knew that the experience of poverty in and of itself was an experience of violence. I wasn't prepared for the level of violence that the women were talking about. And so I would go and do interviews with them in their homes, learning about running out of food, not having enough money for food. And they would talk to me about that, but every time they talked about their experiences with hunger and not having enough money, another story of violence, intimate partner violence, having been abused or neglected as a child, was woven into the stories about not having enough money for food. That's when I realized, aha, this is something actually central, not peripheral to the issues of hunger, but actually at the core of what is going on in families' lives when they're experiencing hunger. The discovery of how trauma interacts with poverty it's been a long discovery, and it's a deepening type of a discovery. So there are a couple of incidences that really helped me to see that trauma was at the core of what I was investigating. The first was really in my first set of interviews with women who use the food pantries. There were two women that really stuck out for me. One woman talked about, she said, "I can't really eat," and I asked her to explain, well, why is it that you can't eat? Why? What's wrong with what's going on? She said, well, every time I eat, I think about the time that I was gang raped by men who were giving me a ride home from the grocery store. And so the story was that she had, really in a lot of the grocery stores around Philadelphia, there are hacks outside because the public transportation is not so great, and when you have groceries, you need some help getting home, and the hacks are hanging outside, so she went outside to get home back to her children, whom she had left by themselves. With her groceries, and one of the guys who offered to give her a ride home had a van. She got into the van, and it turns out there were several guys in the back of the van, and they took her to a parking lot and raped her very, very violently. And then they brought her back to her home and put her groceries up on the porch. And there are so many other things going on around that story, but when she said, every time I go to eat, it reminds me of what they did to me. So I have to drink at least a case of beer before I can eat food. So she's talking about the experience of hunger, but it's really hard to characterize what is it that is that experience. First of all, she's very poor, but she's also very hungry because she can't eat. But why can't she eat? It's actually exposure to violence. It's severe violence that is related to her hunger. Then there was another woman who talked about intentionally not eating. When I asked her about the experience of hunger, it was clear she's poor, right, and didn't have enough money for food. But she said, I literally stopped eating because I felt like by not eating, I would die faster. And so we started to uncover that. And for me, it was really it was a little jarring because I wanted a neat story, right? I wanted the story of, oh, I don't have enough money for food, and then I had to scrimp on my groceries, and I couldn't pay my rent, and gee, I can't find vegetables, and if I just had more food stamps, then everything would be all right. I was looking for the easier story, and what was coming out was this, in some ways, a self-inflicted harm. When we had focus groups from those interviews, during the focus groups, the other women started to connect with those experiences and said, yeah, it's not just the hunger of the body that we know, not having enough money for food and the experience of hunger, the hunger pangs and not being able to lay with yourself comfortable because you're in so much pain from the hunger, but it's also the hunger of the mind. And that's this concept of the hunger of the mind that came out when the woman retold her story. She said, I felt like by not eating, I would die faster. And then immediately the women started saying, well, why didn't you say something to somebody? And I've been your friend for 10 years, and why didn't you talk about it? but there was so much shame and so much that was hidden and unaddressed. That's when I really realized there is something very serious going on that is not separate from hunger of the body, and that's the hunger of the mind. And so really since then, I've been exploring that issue of exposure to violence. From there, I wanted to explore, we were doing research in the emergency room at St. Christopher's Hospital for Children, which is a large children's hospital in North Philadelphia. And during that time we were doing our research, we were looking at food insecurity and hunger more with an epidemiological approach, sort of numbers, not having enough money for food, not having enough money for housing. Of course, no questions about exposure to violence. And while we were exploring that, we're kind of skating along the surface with my other friends who do epidemiology and who we do policy-informed work to show if families had food stamps, it would reduce hospitalizations, things like that. But I was also feeling like we still weren't getting enough of the story from those who know it firsthand. And that was knowing that it was from those early interviews that I was doing with women in Philadelphia that there's something else going on, we're not picking it up. So that's why I started Witnesses to Hunger, where I literally gave the control and the power to tell the story back over to the women so that they could work through their cameras and through their videos and through their voices, audio recordings, to describe what's important to them about the experience of hunger and what they want the world to know. And of course, on the surface, I thought they'd say, look at this grocery store, it's terrible, and gee, look at my wallet, I don't have enough money for food, my refrigerator's empty. That's, again, skating along the surface. What did the women do? They talked about exposure to violence, took pictures of their own bruises, talked about, showed pictures of needles in the playground, showed pictures of the playgrounds that were not safe, and the central issue for them was safety. From there, we wanted to create an exhibit with their stories, and the most important thing was exposure to violence. And yet we were going to have this public display of their photographs and have policymakers there and people from the United States Department of Agriculture there. And what did the women really want to talk about? The fact that their baby's father hit them or that their mother beat them. And so really it was a real challenge to figure out how do we describe this as something that's so core and so central. So it was a lot of the photographs about violence, so we put them in a special place in the center of the exhibit. We did videos in the center of the exhibit to try to express how truly core it is to their experience and really to the policies that we haven't begun to address. So it's also through visually seeing the photographs and hearing their voices and the audio recordings over and over. That nailed it home for me that you can't address the experiences of hunger and you really can't address deep poverty if you're not talking about the trauma. So during all this time and talking to people who've experienced so much trauma and so much adversity, hunger and poverty, it became very clear to me that it was starting to affect me and how I was in the world, how I was thinking about things, not just intellectually, but how I was emotionally handling my own work, my own family life, how I was working with the staff that was working with me. I had several students working with me at the time. I had full-time staff helping me to do these interviews. And we were starting to, I guess you would say, maybe get triggered. Something would happen and we would fly off the handle. Someone would look at us in a certain way and we'd take it very seriously and make a much bigger deal out of it than it really was. And it was really after reading Creating Sanctuary. Creating Sanctuary, as I was doing these interviews with ladies of Witnesses to Hunger, and I was realizing that what was going on during the focus groups when they would have these conflicts and altercations that would arise almost out of nowhere and where I would start to feel a conflict and sort of becoming hyper-vigilant. I realized, gee, I've really got to figure out not only how I can continue to do this work, but I've got to be able to be a better advocate and a helper to the ladies and families of Witnesses to Hunger, but also for my staff and for the people that were working with me and for my colleagues. Because I realized if I wasn't healthy, there's no way that I could continue the work, and you can't do the work alone. We're an interconnected system, our participants, our staff. And so I started to realize that we were expressing a lot of behaviors associated with trauma because we were experiencing trauma vicariously through our interviews. And it was tapping into issues that I had experienced, that my family had experienced. It was tapping into issues that my staff had experienced. So I realized, well, we really need some help, because knowing, when you think about trauma and the experiences of hunger, you realize that the social relationships are so important. They affect your body on such a deep level, in the fabric of the body, in the neurons of the body. So you can't think of a body as just one individual. It's an individual in a group. I realize that I'm a member of a group. I have to stay healthy. I have to keep this group healthy. And that's when I learned about going through the sanctuary training, that we could set up our organization as if it were one system that needed to stay healthy and be healthy and regenerate and address the trauma, not only for ourselves, but also so that we could be the best that we could be for the participants that would come in and need help with housing, with food, with getting away from a partner, with paying a utility bill. And so that's when I realized that, okay, if we can use the sanctuary model and address our emotions and have some tools to help keep the system healthy, that makes all of us healthier, and it actually makes our work more effective. So I took our team to the sanctuary training at the Andrews Institute. There were 5 of us at the time. We took some of our participants as well to go through that training. And that's where we learned about self-groups and all these different kinds of things that we could do to help keep our body, our group body, healthy, and keep our relationships healthy, and help to build resilience. And really, since then, I think it's been 7 years, 6 or 7 years that we've gone through the training. Since then, it's been an extremely important tool to use the sanctuary model, the sanctuary approach at the Center for Hunger-Free Communities. And anybody who comes to work with us, they have to go through that training. They have to sort of be welcomed into the body. And as well, our participants, our research participants, they do community meeting, we do self-groups. They talk about the 7 commitments. And it's been our saving grace, we really think. We think it's helped to keep us healthy and effective. So I've talked a lot about my research and the stories that I was hearing when I was investigating the experiences of hunger and poverty. And I was picking up the experiences of violence and trauma, and child abuse and neglect in the qualitative interviews. And once we started to look at the patterns, if you get enough qualitative interviews, you can see some patterns that are going on among 30 people, 50 people. You can run focus groups. You can test the patterns. You can test the important themes and start to learn about that. So I was feeling very confident that hunger was very much related, intricately related to exposure to violence and to neglect. But I didn't really have the language for what's that neglect. How do I really measure it in a way? I can do it through themes and codes qualitatively and make a strong case qualitatively. But I felt like what we really needed to do is turn it into some numbers and talk to lots and lots of people. And that's when, so through the qualitative research, I started to bring it back into my quantitative research, where we're talking to thousands of people. And so as I mentioned before, I do epidemiological research at St. Christopher's Hospital for Children. And that's where we ask about participation in food stamps, in the WIC program, Women, Infants, and Children, housing subsidies, Heath. And we ask about food insecurity, being homeless, or housing insecurity, we call it, and some other economic security issues. But we never asked anything about violence. I was absolutely sure from our series of qualitative studies that violence was at the core of food insecurity, but I didn't really have the opportunity to measure it in a quantitative way. So that's where I learned about adverse childhood experiences, where that's a measure of what goes on during childhood before the age of 18. And it asks questions about emotional abuse and neglect, physical abuse and neglect, sexual abuse and neglect, and what's often called household dysfunction. Was a caregiver ever in prison, or was the mom depressed? Did you ever witness your mother or stepmother being beaten or yelled at in a very harsh way? And in some ways, it seemed kind of safe to be able to put the adverse childhood experiences measure into the Children's HealthWatch survey, which we were doing, because it was not asking the participants about what's going on right now, because we talk to a lot of participants who have the other parent in the room, maybe their own parent or the other parent of their own child in the room. So we felt like if we ask about what happened during childhood, we can ask about that. So for the past 4 years, we've been asking the ACEs questions coupled with the food insecurity questions. It takes a long time to build up your research on that. It takes a long time to build up the numbers. And so it was really last year that we started to look at the numbers. We had over 1,000 people that we had spoken to and who had answered the ACEs survey. And so that's when we juxtaposed ACEs next to the food insecurity questions, which are 18 questions about running out of money for food, not eating a balanced diet, cutting your meals, not eating for a whole day. And we did our data analysis related to that, and we controlled for participation in food stamps, and we controlled for poverty, and we controlled for many other things. And what we found was that adverse childhood experiences are very strongly related to food insecurity, especially the most severe levels of food insecurity. It's called very low food security. And the odds ratios, of these are things that we speak in epidemiology, were extremely high, higher than issues of depression. We had to control for depression as well, but the implications were profound. And we were able to prove with the numbers that adverse childhood experiences are probably the single most important predictor of very low food security at the household level, which is what I call hunger. One thing from there that really struck me was, and we looked at each of the adverse childhood experiences by themselves in relation to the spectrum of hunger. Each one was related by themselves, but the one that rated out the highest was emotional neglect, not feeling love. So those who reported very low food security at the household level or hunger, that they about 60% reported experiencing emotional neglect as a child. And if you compare that to families, the caregivers who said they didn't have any hunger issues at all, about 20% said they experienced emotional neglect. That for me was extremely upsetting because it says that our city and the families in our city are so isolated, and just that experience of love. How do you relate that experience of feeling loved and feeling wanted and cared for to not having enough money? This is very profound. It was very upsetting for us to see that. And so while pediatricians and clinicians may be looking at these numbers and say, oh yeah, that makes sense, when we saw those numbers, we literally wept. We couldn't believe it. We knew it in our bodies from the qualitative stuff, but to see it in the numbers, it actually made it even more profound, more upsetting. And that creates a lot of issues about how do you talk about hunger to policymakers. One of my other research studies is built off of what I've learned through my studies with Children's HealthWatch, with the adverse childhood experiences and exposure to trauma, and the exposure to violence that the families of witnesses to hunger were talking about. We decided to create an intervention study in the welfare system in and of itself to address trauma and adversity head on as a part of our systems. So the Building Wealth and Health Network is an intervention study where we work with caregivers of little children to address their issues of trauma. We run self-groups, helping the participants in a group format to work on issues of safety, emotions, emotional management, dealing with loss and letting go, dealing with grief, unaddressed grief and mourning, and also helping them to think about their futures, how to create a safe future, and how to think beyond the moment. What we also do with them is help them open up a savings account so they can literally practice thinking about the future through savings, whether they're saving 5 cents, 50 cents, or $1 a week. We want them to think about the future because we recognize that exposure to trauma and adversity really affects your ability to set goals, to think that you have a life beyond today. And we have found that through the Building Wealth and Health Network, which is a TANF program, it's a cash welfare program where people actually have to come to our peer support groups in order to receive their cash. We have found that we've been able to reduce depression. We actually cut depression in half for the participants in our program. That's very profound, and that tells you that you can't expect people who are low income to get into the workplace and succeed right away. There are a lot of issues that they need to address that are very deep, that go back to their own childhoods, and that, in other words, go back to the generations before them, that they have to address, that they need a safe place with other peers, with other people who've experienced it, to be able to explore those emotions, to let go, to start thinking about the future. And so we've created a safe place for the caregivers to really start to explore those deeper issues. And we're seeing that it reduces depression. We've also seen that it increases their income. And that's really exciting. How do we get this to policymakers? It's very challenging. And that's one of the reasons I started the Building Wealth and Health Network in the cash welfare system, because I figured if I can show it practically, how if we address trauma, we can actually increase the incomes for the families that we work with. In other words, we can increase their ability to find a job and to keep a job. That looks very effective from the state's perspective, because they need people to get into employment, right? To get off of welfare. That's sort of the goal, to get people off of welfare. So I think one of the best ways to talk with policymakers is actually to show them the evidence, not in theory, but in practice. And that's why I'm working on inserting trauma-informed approaches into the practice of what we do every day. And I'm measuring it, and I'm able to show the outcomes. This improves employment, it improves income, and probably because depression is on the causal pathway. So we're working right now to create a policy brief, to do forums where we can talk directly to legislators about the importance of addressing trauma. And I think in my world, one of the most important policy asks, and also one of the most important policy interventions, is this concept of the two-generation approach. Really, previous to the past 5 years, most people would think about, let's just focus on the kids. Let's help the kids who are living in poverty, and let's get them into daycare, and let's give them behavioral health supports, which is positive, but it's leaving out one of the most important pieces of the equation, which is the caregiver. And that's, so right now, the Agency for Children and Families, which runs the cash welfare programs, the foster system, fatherhood programs, they're recognizing that you cannot take one generation and just affect one generation, because we're so interconnected, because trauma is so reliant on the connection, especially of caregiver and child. You've got to work with both as if they're a part of a single system. So we call it the two-generation approach. Yes, get the child into a good daycare, but and get the family into a safe and affordable home. Get the caregiver into a good job where she can really succeed. So I think that's, so a lot of people think about, well, let's focus on housing and food and daycare as the two-generation approach. That's an okay scaffold, because within that scaffolding, you can insert the issues of adversity and trauma. And it's exciting to see that taking off across the country. And right now I'm learning that they're doing it in preschools, that they're taking trauma-informed approaches, that they're talking about conflict resolution, compassion. That's really exciting. Unfortunately, I think it'll take another 15 years for it to catch on at the national level in terms of our leaders in Congress, but it's great to see it in practice happening right now. I think we're starting to see some impact on policymakers. For instance, I talked directly with Senator Bob Casey. He's our senator from the state of Pennsylvania. He's been a fantastic advocate and leader on the issues of poverty, child poverty, has a bill on the Hill right now on addressing child poverty. He's a strong advocate for food stamps and adequate housing. And he's very interested to know what the issues are really for children. How can he best help children? So again, that avenue of focusing on young children is exciting and important. And we've started to introduce the concept of toxic stress. And that's when children experience very severe adversity to the point, which can include abuse and neglect, but also hunger, homelessness, severe deprivation. Those have an impact on a child's neurons. And that's so important. During their first 3 years of life, a child is developing 700 neurons a second. So any kind of disruption to that brain development, to the cognitive and social emotional development, can have very severe consequences later in life. So that's another avenue to talk about trauma, is to talk about toxic stress for young children. So I've given testimony in front of Congress, in front of the United States Senate, talking about the importance of food stamps and WIC. And I've talked about the experience of hunger as a form of toxic stress, And so I'm slowly inserting exposure to trauma and adversity as an important core issue that needs to be addressed. And also a reason to improve our programs for families with young kids. So I talk about trauma in my congressional testimony, in both the House of Representatives, in the United States Senate. I've been to the White House several times to talk about the experience of hunger and to share the stories about adversity and trauma with my colleagues. It makes everybody uncomfortable because it's a lot easier to think about food stamps. But the fact that we're in there talking about this experience of toxic stress, of cognitive, social, and emotional development, I think people are starting to listen. And when you have the White House listening with such attention, and you have the Agency for Children and Families, which is Health and Human Services, you have major national administrators who administrate billions of dollars across the country in their programs, to have them think about trauma and adversity as a core issue, that becomes very exciting. It may sound really funny, and it is on the surface. I think about Paul Ryan, who's the Speaker of the House. Last year, he invited one of the participants of Witnesses to Hunger to provide testimony on what is the experience of poverty and how can we, through our policies and programs, improve what we do for the poor and with the poor. And I think before I learned this trauma-informed approach, before I learned about the experiences of trauma and how to address it by creating a stronger social bond, about being more vulnerable, about being able to express emotions and giving people a safe place to talk about their emotions. Before I learned that, I would have taken a more adversarial approach, and I would have encouraged Tiana Gaines, who gave that testimony, to be forceful and kind of get out there with her fist and say, "You're not doing right by me." She did that, but she did it in a really beautiful way that was very enticing, very inviting. And around that same time, we had one of our exhibits of Witnesses to Hunger with the violence photographs in the House of Representatives with the bruises on them, or people talking about violence, homelessness, hunger through their photography, through their experiences, and intimate partner violence. Soon after that, we were invited by by Congresswoman Lee from California to meet briefly with Paul Ryan. And when Tiana Gaines, who's one of the witnesses and one of the members of Witnesses to Hunger, had a chance to meet him, he reached out to shake her hand. She said, "No, I like hugs." And she hugged him. But that moment of the hug is it's profound because it expresses, if you didn't think about who's doing the hugging, right? It expresses a sense of a shared humanity. And I think that's what's been missing from our policymaking. It's been missing a lot from our programs, our cash welfare program, our food stamp program, even Medicaid, housing. We're missing the humanity, our sense of connectedness. And so it's wonderful to be able to, through that trauma-informed approach, know that actually there's a different way you can talk to legislators and policymakers. So I find that the way that I talk about trauma, the way I think about it, the way I think about the way I do my work, it makes me a kinder person, and it helps to invite people in. And hopefully, over time, that will have some impact. If you're really going to address trauma and the issues that I care so much about, which is poverty, deep poverty and hunger, you really have to let go of something in order to create change. And that's one thing I learned from creating Sanctuary and just from trauma theory itself, is that when people have an experience of adversity, have a terrible experience, they kind of hang on to that as if it's the only thing, because on the other side of it is an abyss, right? So you start to reenact, right? You create more crises than you need another crisis to somehow feel safe. And I think in the United States, I think we're like that. I think that as a society in the US or in North America, we are addicted to the trauma. We're addicted to the violence. And you can see it in our rhetoric. You can see it in the people running for president. Every month it feels like there's a massive violent act. There's a mass shooting in Charleston, based in racism, but it's also based in this generations of trauma that we have unaddressed as a society, as a culture. And I think what we need to do is start to, I'm not sure if I can really name the thing that we need to let go of, but I think we need to let go of our sense of control. Like we can keep it together. I think we need to ease up a little bit and let the vulnerability come out. Be okay with not knowing the answer. creating a place where we can start to express our vulnerability. Because through vulnerability, people can start to connect. And so when you think about, when you have a great friendship or relationship, it's not really based on skating on the surface. It's on your ability to connect. But we can't connect with each other because we're trying to keep it in control, and we use violence as a way of keeping control. So we need to let go of our sense of mastery and control, that we have all the answers. And we need to have more dialogue in safe places. We need to have more community forums where we're talking about violence in our own communities. And I'm not just talking about, get rid of the guns and we need more police. That's still just fighting violence with more violence, right? We need to talk about how it makes us feel. And we need to insert a sense of love and connectedness. I mean, again, I'm coming back to that issue of emotional neglect. We are an emotionally neglected culture. And I think in Philadelphia, it is profound. And you see that emotional neglect when you walk through the neighborhoods. You can see abandoned home after abandoned home. You can see families living in abandoned homes without electricity, without running water. And that, from my perspective, is an indication of our societal neglect of each other. That's the city leadership's neglect. It's the state's leadership's neglect, federal neglect. So you can see it all throughout. It's not just interpersonally with just people. It's like with the houses that we've built, the urban infrastructure, the welfare system, the public assistance programs. That neglect in form of violence is in there. So we need to sort of let go and say, hey, look, let go of our sense of controlling it, like not talking about violence, not talking about feeling neglected. We need to be able to say, hey, I'm feeling a little neglected. I feel sad. I feel a little out of control and I need some help. But we need our leaders to do that. And we need the heads of organizations to do that. We need more people to be able to speak out on trauma. And only from there can we really develop a sense of future. And it really comes back to those 4 tenets: having safety, dealing with emotional management. You have to let go of something. You have to address the loss, the grief. There's a lot of grief in our culture, our society. There's a lot of grief in our own families. Once you recognize that, you can start to let the future in and do some great things. If we saw in the future a trauma-informed city in Philadelphia, we would see not a single abandoned home. Number one, we would see it would be so visible. It's in our neighborhoods. So we would see that there's not a house that has a tree growing through the roof. There's not a house that's boarded up for more than a week. Licensing and inspection has jumped into gear because they know that homelessness and poor housing are related to toxic stress that are a form of trauma in and of itself. We would recognize that building safe and affordable homes is a way of doing a trauma-informed approach to living, to life. We would feel as if our city is a single organism, a healthy organism, resilient, able to grow and to flourish. We wouldn't see our playgrounds with a lot of needles in them, because we would know that those who are experiencing problems with drug addiction and severe deprivation have a place to go because they have mental health supports. They have places where they can go to get the peer support that they need. Our systems are addressing those needs. And we would see certainly a cleaner city. I think we would see people not yelling at each other so much. There's one thing I learned about Philadelphia is that we have this anger in Philly. Actually, there's a woman in California that, I don't know, I saw it on the web somewhere. She had a shirt. She said, "I'm not angry, I'm just from Philadelphia." And I think it had someone giving the finger. And, in the emergency room at St. Christopher's Hospital, I could actually feel that it's palpable, our anger. And it's okay to be angry, but you got to kind of let go of the anger and let something else flourish. And I think we would talk to each other in a nicer way. We would give each other more hugs, and it would be a meaningful hug. So that's the kind of city that I would see if it was a trauma-informed city. And again, I can't stress enough the importance of housing. again, the way that our housing stock looks in Philadelphia is a very visible, concrete form of violence and neglect. It is trauma in and of itself. Once we can fix that, that means that we're also dealing with our interpersonal relationships, with our own humanity as a single organism, lively, resilient, and full of love. That's when we have a trauma-informed city, that love, what is it called? It's not a statue, it's a sculpture. In a trauma-informed city, that love sculpture right there near City Hall, the beautiful fountains and the park around it and the skateboarders there, where you can see the art museum, that sculpture would actually mean something. The city of brotherly love and sisterly affection in reality. There's one thing that is really hard to address, and that is the issue of secrets and the stigma. Now, it's one thing to say, to talk about the stigma of hunger, right? I don't really want to admit that I was hungry as a kid. Well, that is a very serious stigma, and it's something that we need to overcome, and that's why I started Witnesses to Hunger, so people could get over that, to break the silence. But it's not just about the silence of hunger. What drives the hunger is the trauma. We have to break out of the silence, and we have to feel uncomfortable with it. It's upsetting. But if we can create some safe places to talk about it, we can allow it to come out. But right now, we're skating along the surface all the time. We don't want to touch it because it's too upsetting. Why? Because it affects us as an individual, as a human being. It's not just somebody else's problem. It's like it's got to deal with the problem in ourselves. And I don't know how to break that. I do know how to break the silence, right? Because we do Witnesses to Hunger and I talk about it. But I feel like we need more people to join in. We don't have enough people speaking out. And I think if people started to speak out, it would be so surprising that some very key decision makers, legislators, leaders, and their staff have experienced trauma themselves and have never had an opportunity to let it come out, to open it up. So that's what I mean by the loss. We've got to let go of our sense of mastery and control and break the silence. It's okay. Break the stigma. And I think that's, if we continue to not talk about the trauma, we're going to get nowhere. And in 15 years, 20 years, we're going to see the same insanity that we see today. And unfortunately, the housing stock in Philadelphia, the way Philadelphia looks now, is really not that much different than what it looked like in 1901. And that's a big problem.